Welcome to the Retirement Made Easy podcast, a show created to be your go-to source for straightforward retirement advice. Best of all, it is presented in a language that you can understand. Are you ready for some straight talk on retirement planning without all the fluff? Well, you found the right podcast. Here's your host, certified financial planner, Greg Gonzalez.
Hey, welcome to another episode of Retirement Made Easy. I'm Greg Gonzalez. Today's episode actually comes from a listener submission. A gentleman sent a message through our website. We were kind of asking for topics of interest that listeners wanted to hear us discuss on this podcast. And this gentleman, I keep everything anonymous, but he wrote me a really nice message, and he's actually on baby step 7 for all the Dave Ramsey fans out there that know the baby steps. They know kind of where he's at. So him and his wife have done very, very well. But he wanted to see if we could do an episode geared more towards healthcare planning in retirement and how we make wise decisions in regards to health insurance and Medicare decisions. And healthcare planning just happens to be one of the 5 main pillars of retirement planning. The other pillars are legacy planning, income planning, tax planning, and investment strategy. And I know a lot of people forget to do some of this planning and they just jump into retirement, and that's where they can find themselves in some trouble. So let me mention these 5 pillars of retirement planning, and we focus on these as we're helping people plan for retirement at my firm. Again, the 5 pillars of retirement planning: healthcare planning, legacy planning, tax planning, retirement income planning, and the last one is investment strategy. And so with healthcare planning being one of the 5 retirement pillars, I wanted to spend some time on this episode kind of having this discussion. And hopefully there's going to be some big takeaways and some ideas that you can implement, or at least know where to go or where to start when it comes to planning for your healthcare in retirement. So that's what we're going to talk about on today's episode of Retirement Made Easy. If you're a new listener, I invite you to check out our website, retirementmadeeasypodcast.com. You can check out our resources section where you can download free resources that will help you with your retirement planning. And next year, we will be adding a Social Security planning guide and a tax planning guide and even a healthcare planning guide. And for those people out there that are looking to speak with or work with a retirement planning specialist, there's a section of the website where it says work with us, and you can fill out a form and we'll get in contact with you that way. But let's jump into this topic, healthcare planning in retirement. I mean, we could talk about this for 5-6 hours on end and not cover everything. But I want to at least start this conversation, and there's a lot of takeaways here. There's a lot of ways to go about this, a lot of different roads you can go down, but I wanted to talk about as many of them as I could and on this episode. Now, you may just pick up 1 or 2 things on this episode, and that's okay. For those of you that have a great, firm understanding of healthcare planning in retirement, that's fantastic. Hopefully, we can just add to that knowledge base. So let me start off with this idea that you got to wait until 65 before you retire, because then at 65, you'll be eligible for Medicare. So that's true. You've got to be 65 to qualify for Medicare unless you're disabled. And there's some rules around your disability that you should check into if you're in that camp. But if you're not disabled, yes, Medicare starts at age 65. You can apply months beforehand. And by that, I mean 3 months before your 65th birthday up to 3 months after your 65th birthday. That is your first opportunity, or eligibility, as they call it. Now, realize that there's people out there that may decide to work past 65 and still remain covered under their employer's group health insurance plan. And that's totally fine. Upon separating from service or retiring, once you're 65, you're eligible immediately for Medicare. So if you work until age 66 and your birthday's in February, great. You can immediately leave the group health insurance coverage and be ready to then just hop on Medicare. Now, one of the things that you need to consider is, what if you have a younger spouse who's not yet 65? Well, one of your options is if that spouse was covered under your group health insurance, spouses are eligible for 36 months of COBRA. And so you'll want to check on the price of that. What would that be if you retired, hopped on Medicare, and then your spouse remained covered under COBRA, maybe until they were age 65 and eligible for Medicare? That is an option. COBRA is an option. So we need to say, okay, what is this going to cost us? The good thing about COBRA is it's the same health insurance that you've been accustomed to, so no changes there. For a lot of people, they say, gosh, the price of COBRA is just unreasonable, and they want to look at other options. And they might say, well, let's look at the healthcare exchange and see what that's going to cost us, and maybe shop those different plans. And when we describe a well-formulated retirement plan, the healthcare component, it should be accounted for there. So if we knew ahead of time, let's say one spouse was going to retire at 65 and the other spouse was 5 years younger, and there was a gap of 5 years until they were eligible for Medicare, well, we need to have accounted for in your retirement plan where the money is going to come from to pay for that health insurance coverage, whether it's COBRA for 36 months or whether it's the healthcare exchange or something like that. Maybe you had thought ahead of time and said, hey, what about an HSA, saving in an HSA to be able to make up some of those healthcare expenses during that period of time and throughout retirement. So HSAs are very, very popular. Now, the limits for HSAs are a lot different than any other account. So for 2024, for self-coverage, self-only HSA limit, if you're single, it's $4,150 per year. So that's the most you can put in an HSA. That's the contribution limit. For family coverage, it's double that. It's $8,300. And if you're 55 or older, they give you an additional catch-up of $1,000. Now, one question that we get a lot is, how do we invest the money in the HSA? Because you're able to kind of pick the investments within your HSA, just like your 401k. Now, there's people out there, depending on your situation, whether you can withstand seeing the money go up and down. This will be dependent on your risk tolerance, of course. And I know there's people that say, no, I want to keep the money in my HSA safe because I'm going to use it and I don't want to see it that fall in value. And there's other people that have much bigger balances in their HSA, and they kind of look at that money as more long-term funds to cover healthcare expenses throughout their retirement. So you've got to talk to your financial planner to come up with a strategy. You know, there's some clients that we work with that they want to keep at least 1 year's deductible or total possible out-of-pocket expenses in like the money market portion of their HSA, and then the rest they invest into mutual funds and things like that. So there can really, really be some strategy here when it comes to those that utilize an HSA. So it's a discussion you really, really need to have with your financial planner who understands your situation and your goals. I think it starts with, okay, how are our healthcare expenses going to be different in retirement? So I would challenge you next time you meet with your retirement planner to say, okay, let's get a good idea of what the costs of Medicare are going to be, or what the cost of COBRA is going to be if you're going to go down that route, what the cost of the healthcare exchange, what those premiums are going to be, what the annual deductible per person is for those different plans that you might be utilizing. And a part of this discussion really should be long-term care expenses, even though that likely those expenses are not going to come until maybe 2 or 3 decades into retirement, kind of those last 5 or 10 years for most people. But we really, really need to have that discussion of how are we going to pay for that? And what are those costs projected to be at that time? For example, there are some of our clients that say, well, those HSA dollars, those can continue to grow tax-free within the HSA. And then when we draw them out, as long as they're used for healthcare expenses, and long-term care is one of those, well, it comes out tax-free. So you get a tax deduction on the way in, it grows tax-free or tax-deferred, and then whenever you pull the money out, as long as it's used for qualified healthcare expenses, you pay no taxes. on any of the growth or any of the principal. So I'll stop right there and challenge you to see, hey, is an HSA, is that something we have access to that could really help us and benefit our retirement plan? And I will also issue a caution to you. Some people have access to an FSA, and in a lot of those plans, it's kind of use it or lose it. So the money that's in the plan, by the end of the year, you've got to use it for stuff. I've had clients that have joked and said, oh, we got to go to Walgreens to buy a bunch of Band-Aids or Advil because we're going to lose that money in our FSA. So make sure you understand, hey, what do we have access to? What are the rules and parameters around it? Is your employer contributing any money to the HSA? If so, how much? We really, really need to understand this kind of stuff. And I will say this, I'm going to stop for a minute and say this. A lot of people delay their retirement because healthcare is so expensive. And what do I mean by that? Well, for the 63-and-a-half-year-old out there that says, okay, I want to retire, I'm going to be eligible for COBRA for 18 months, and then I'll be able to hop on Medicare once I turn 65. I've had many, many clients that have gone this route, and they've said, I'm just going to bite the bullet and for 18 months pay for COBRA. And come to find out, well, as we kind of do our due diligence, the price of COBRA is $800, $900, $1,000 a month. But again, it's only to bridge that gap from 63 and a half until 65. But if we can plan ahead of time, we can come up with a strategy that's going to work best for you. And I've even had clients that have semi-retired, and maybe now they're working 25, 30 hours a week. Maybe they're not making as much money. Maybe it's in a new industry, something maybe that they're passionate about or they enjoy more, but it includes health insurance. Sometimes it's in the public sector where you've got really, really good benefits and you don't have to work 40 hours a week. There's even some in the private sector that offer good health insurance and you don't have to work full time. And just that health insurance coverage is worth it, is worth working part time. If you're interested, we'll provide a link to an article that will show companies out there that offer health insurance coverage to people who are part time. I know Costco, for example, is a very, very popular place for people to work to get excellent health insurance coverage, and the premium they pay is like next to nothing. So I think as you plan for healthcare in retirement, there's the years prior to 65, and then the next season is 65 and after, once you're eligible for Medicare. And that's going to look different. That's going to absolutely look different. And it's kind of a phase. Phase 1 is before 65. Phase 2 is after 65. Now, one thing I'll mention is Obamacare, or what I call the healthcare exchange. And there's a lot of people that want to know, hey, what does that cost us, Greg? What's it going to cost us every month for that? Well, it's going to depend on your income and what plan you choose. And it's also going to depend on where you live, because it's different zip code by zip code. And what do I mean by that? Well, let's just take, for example, an imaginary hypothetical couple. I'm based out of St. Louis, Missouri. And so if I typed in my zip code on healthcare.gov, I could put in this imaginary couple's date of birth, put in the zip code, put in their income, and a couple different screens. I could follow the prompts and I could get a selection of options of coverage that's out there. And it's really based on your income. That determines how much of a subsidy you're going to get. And maybe in the show notes, I'll try to have a link where you can see, and the subsidy that you're entitled to is based on the federal poverty level with this chart, and you can see where your income falls. Then it goes to a family of 2 if we're looking at a married couple. And the lower your income on this poverty level, the bigger the subsidy you're going to get. So the lower the premium or out-of-pocket premium that you're going to pay. So what some people do is they kind of map their income out in those years before 65 to have lower taxable income, and therefore they have cheaper health insurance and a bigger subsidy. And this can all be kind of planned out ahead of time. Of course, from year to year, the price of this insurance is subject to fluctuation, and the poverty guidelines are inflation adjusted, so they do move a little bit year to year. But as generally speaking, you can get an idea of what it would cost if you wanted to go before you turn 65 and are eligible for Medicare, if you wanted to come up with a healthcare plan through healthcare.gov, or what people call Obamacare, and really estimate what your taxable income is going to be in those years, which will then dictate how much of a subsidy that you get, and therefore what your monthly health insurance premiums will be. Now, with that being said, I've been doing this long enough that the clients of ours that choose to go that route, they will say, well, this health insurance is a lot different than the group health insurance that I had when I was working. In fact, the annual deductible is a lot higher, and there might be other nuances or differences in the plans that are available than you're used to. So it might be an adjustment, and some people don't like that. So you've kind of got to plan ahead so you're not surprised. And that might involve saving in a healthcare account, be that an HSA, a brokerage account, or something like that. Now, one thing I'll mention, and this might help some people out there, it's not going to help everybody, but I want to remind people out there to check into how your vacation and sick days are going to be paid out once you retire. I've had several clients that forget about this, and it ends up that, hey, they've got a check coming for $30,000 being paid out on sick time and vacation days that they were not aware of. And a lot of times they can use this money. Sometimes it can be thrown into a 401k and the taxes are deferred on that money. And other times people want to use this money and earmark it for their healthcare. So it's worth definitely checking into and seeing, hey, are those sick days, vacation days paid out? And how are they going to be taxed? How much am I going to be expecting, if anything at all? And that way you can plan ahead. I had one client years ago, and their sick time and vacation days were $45,000. So definitely something you want to be aware of there and at least check into. So let's talk about one more thing that I'll mention, and then I want to skip over to Medicare. Once you turn 65, you're eligible for Medicare. We'll talk about supplement plan. We'll talk about Plan D for drug, and maybe a Medicare Advantage plan, because these are kind of words that you may have heard, and maybe some people have given you good information or bad information, and we'll talk more about it. But one more thing when it comes to HSAs, you have a one opportunity in your life to take money out of your IRA and transfer it into your HSA. So why would you want to do this? Or why would you consider doing this is a better question. So if you take the money out of your IRA, well, you're going to have to pay taxes on that money. It's taxed as ordinary income. But if we transfer it to an HSA, it grows tax deferred, tax free, just like your IRA did, but withdraws as long as the money is used for a qualified healthcare expense. You don't have to pay taxes on the distribution. Now, the bad news is there's a limit on how much you can transfer. And again, it's a one-time transfer, and it's up to the annual limit. So, which I mentioned, the family limit is $8,300 in 2024. And then if you're over 55, they give you a catch-up of an additional $1,000, which brings you up to $9,300. There's some special rules with it that you need to be aware of. Like, you've got to be covered under a high deductible healthcare plan for the next 12 months. You can't do it and then retire. So this all goes into the strategy. This is something you got to have a conversation with your retirement planner to make sure, hey, is this something we should consider doing? If so, when? Or are we even allowed to do it? And like I said, very, very few people in my experience are aware that you can do something like that. But again, check into it, Google it if you're interested. All right, let's switch gears. Like I said, now you're 65, eligible for Medicare. Now, if your spouse is still working, let's say you're 65, you retire, your spouse is still working at 62, and they're covered under their group health insurance plan, and you say, gosh, that's pretty darn good health insurance. I'm going to retire and then just be covered under my spouse's group health insurance. You can do that. That's fine. What you would want to do, though, is apply for Medicare Part A, which is hospital insurance. There's no monthly premium for that, but you want to be very clear, let Medicare know, hey, I'm not signing up for Medicare Part B, which, depending on your income in 2024, it starts at about $175 a month premium. So if you're covered under your spouse, their group health insurance, you would just say, no, I just want to sign up for Medicare Part A. It's free. And then whenever your spouse, let's say, retired a couple years down the road, they're eligible for Medicare. Then at that point, you would switch over to Medicare Part B, and maybe you would want to look at a Medicare Advantage or a Medicare Supplement plan. So let's talk about Medicare Part B really quickly. Medicare Part B in 2024 has an annual deductible of $240, and it works on the 80-20 rule. And how much you pay as far as a monthly premium is determined by your income 2 years ago. So that would be in 2022. They look back and there's a chart, and you can look this up online. And as long as your income, they put you in tiers, and the lowest income tier is $175 a month, which if you're collecting Social Security, it comes right out of your Social Security check. If you're waiting until 70, let's say you're 65 years old, you're on Medicare, waiting until 70 to claim your Social Security benefit, then you're going to have to pay that $175 premium out of pocket. That covers 80%. So what about the other 20% that you're on the hook for? Well, you can certainly pay out of pocket and continue that way, or you can look at a Medigap plan, also known as a Medicare Supplement plan. This is commonly referred to as a Medicare Part G. And when we talk about Medicare, it's kind of the alphabet soup. But a Medicare Supplement plan is what a lot of people call the Cadillac plan. You're going to pay between $100 and $200 a month for a Medicare Supplement plan, and it covers that other 20% that Medicare Part B does not cover. And you say, well, how much is it? Is it $100 a month? Is it $200 a month? Is it anywhere in between? It really depends on your zip code. I have clients in over 20 states, and if they're on Medicare, well, some states are more than others. Some zip codes, they may be 20 miles apart, but depending on your zip code, you may pay more or less than someone else. And then you might have heard Medicare Part D for drug. So if you're on prescription drugs, you would want to maybe consider a Medicare Part D for drug plan, and that may cost you $25 a month. It may cost you a little more. It may cost you a little less. Now, the thing about a supplement plan and Medicare Part D plan that we've combined together is they don't cover dental, they don't cover vision. So if those are insurance coverage that you're used to, well, you might look into getting your own plan or just maybe pay out of pocket. Or again, that's what that HSA is so valuable for. It can pay for vision and dental. Now, the other type of Medicare plan is called a Medicare Advantage plan. Many people call this a Part C, and that's, again, a Medicare Advantage plan. And whether you're looking at a Medicare Supplement plan, Medicare Advantage plan, Medicare Part D, they're all offered through private insurance companies. So I'm talking AARP, I'm talking United Healthcare, Aetna, Cigna, all these different Humana, Blue Cross and Blue Shield, Mutual of Omaha, Transamerica. And what you'll find is the premium or the price of the Anthem supplement plan is more or less than the United Healthcare plan, or is more or less than the Cigna plan. So you really got to dive into the details of how the different supplement plans compare to each other. Do they allow you to keep the same network of doctors? For the Medicare Part D for drug, do the different plans cover the prescription drugs that you are currently taking? That's very, very important. And if they don't, that's a problem. And so as far as picking the actual plans that are going to be best for you, I would highly, highly recommend meeting with an independent Medicare broker. And if they are truly independent, they're going to be able to offer all the different plans out there, compare them side by side as far as what they cover, the nuances, the deductibles, all that kind of stuff, and of course the cost. And then you can truly find the plan or plans that are going to be the best fit for you. And it doesn't cost you any more than trying to do it yourself. We have somebody very, very good here in St. Louis that works with a lot of our clients, and she's very, very honest. She actually was a captive insurance agent where she could only offer one brand or one insurance company's policies in the past. And that's why she became an independent broker where she could offer a slew of different choices to really, really find the best fit and the best price for people. So I would highly recommend, again, find somebody independent that can offer them all and really, really teach you how they work and the policy that you're going to be getting. So let me circle back with Medicare Advantage plans. Kind of give you some ideas when it comes to Medicare Advantage plans, some benefits, some drawbacks, and that kind of thing. So Medicare Advantage plans, for those that are on a tight budget, they make a lot of sense because they have low or zero premiums. In a lot of instances, there are zero monthly premiums. Other benefits is sometimes they'll include prescription drug coverage where you will not need a Medicare Part D. They have other benefits. Some Medicare Advantage plans, and again, the different insurance companies have their own version or their own product, if you will, of a Medicare Advantage plan. So you have to kind of look at what that specific plan offered through that specific company offers you. What's the value of it? So they will sometimes offer dental, vision, and hearing benefits. And also some of them include gym memberships or discounts. So those are really the benefits of Medicare Advantage plans, the pros, if you will, that a lot of people like about them. So what do people not like about them? Well, if you think about it, if it's a zero or low premium, a lot of times the deductible is going to be really high or higher than maybe you're used to. The other thing is sometimes it kind of makes you go to a select specific network of doctors like an HMO or a PPO plan. So you might be limited on where you can access care. And if your doctors that you're used to going to are not in that network, well, you might have to find new doctors. So that's something you'll want to check into. Some plans require like referrals to go see a specialist. And another thing is the plans will change year by year. So you got to stay up to speed. And that's why it's so good to have a Medicare specialist, independent agent that's alerting you of these changes and how your policy may get better or worse depending on the year. And then switching plans. So sometimes switching into a Medicare supplement plan, if you don't like a Medicare Advantage plan, it might cause you to have a medical exam where you actually have to qualify for it. And a lot of you have heard the term, well, you got to wait until open enrollment, which is a period of time in a year where you can make changes to your plan, to your Medicare coverage. So, for example, the Medicare specialist that we work with here in St. Louis, she is busiest during open enrollment because people have a small window where they can then make changes to their Medicare plans, be it a Medicare Advantage plan, Medicare supplement plan, Medicare Part D for drug, whatever it is. So that window, for example, the open enrollment period in 2024 is October 15th through December 7th of 2024. So looking at less than 2 months. So the question always is that I hear over and over, what's better, a Medicare Advantage plan or a Medicare supplement plan? You have the people that never go to the doctor in perfect health, and they don't want to pay for something they're not going to use. So you need to really understand the differences between the two plans. Are they within your budget, of course, and the premiums are going to, of course, go up over time. I think we can all agree that healthcare costs go up more than general inflation. And if you need to do a little research and fact check me, believe me, it's about almost double, if not triple, what general inflation goes up in a year. And healthcare costs include health insurance premiums, and they will continue to go up. If history is any guide, and this is only my opinion, but I think it's fair to say that that's the direction things will stay headed. I had a client that retired once. He said when he got a raise every year, he was hoping that his increase in salary was at least as much as the increase to his group health insurance premium. So it was a wash, meaning his take-home pay remained the same. And I just thought that was just wild. But this guy worked for a hospital for 25 years, and that was his experience. And that's what I want to leave you with. As you're constructing your retirement plan, have you remembered how you're going to pay for healthcare expenses in retirement, for long-term care expenses? And do they have an adequate adjustment for inflation? Because we can know, okay, this is what our Medicare premium is going to cost today, but we can go back and look at how much Medicare Part B premiums, Medicare supplement plans have gone up over time. And again, it's much, much more than general inflation. And I say that not to scare you, but to arm you with the truth and something you really, really need to plan for. Because healthcare costs, are going to be one of your biggest expenses other than taxes in retirement. One last thing before we go, check out our YouTube channel, Retirement Made Easy. You can see videos of yours truly explaining retirement planning topics, and I really, really think you're going to enjoy those. We're trying to release those couple episodes a month, so be sure to check out Retirement Made Easy YouTube channel. I'll see you next week, and remember, always dream big. The opinions voiced in this material are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, please consult your attorney, tax advisor, or financial advisor prior to investing. This is a hypothetical example and is not representative of any specific investment. Your results may vary. All performance referenced is historical and is no guarantee of future results. All indices mentioned are unmanaged and may not be invested into directly. The SmartVestor program is a directory of investment professionals. Neither Dave Ramsey nor SmartVestor are affiliates of St. Louis Retirement Advisors or LPL Financial. There is no guarantee that a diversified portfolio will enhance overall returns or outperform a non-diversified portfolio. Diversification does not protect against market risk. All investing involves risk, including loss of principal. No strategy assures success or protects against loss. Securities and advisory services offered through LPL Financial, a registered investment advisor, member FINRA, SIPC. And here's another minute of disclosures from our compliance department. Traditional IRA account owners have considerations to make before performing a Roth IRA conversion. These primarily include income tax consequences on the converted amount in the year of the conversion, withdrawal limitations from the Roth IRA, and income limitations for future contributions to a Roth IRA. In addition, if you are required to take a required minimum distribution in the year you convert, you must do so before converting to a Roth IRA. As I have said on countless episodes, this information is not intended to be a substitute for specific individualized tax advice. We suggest that you discuss your specific tax issues with a qualified tax advisor.
Thank you for listening to the show today. Check us out at our website, retirementmadeeasypodcast.com. And if you want some help from Greg, submit your questions at the bottom of the page or sign up for a 30-minute retirement coaching session with Greg. We'll see you next week.